Good afternoon, everybody. Welcome to the Governor's Working Group this afternoon. Bear with us. This is our second time using Facebook Live. So for those that are joining us on the phone line and then also on live stream through Facebook Live, welcome to the North Carolina Governor's Working Group. We have email updates and meeting agenda and minutes that are a part of the website link. Hopefully we'll also look that up in the Facebook Live event too as well. So we're going to go ahead and start this meeting off. So we're going to get some updates and co-chairs from our chairs and co-chairs. So they'll be coming up here individually and talking about themselves and their organizations and giving us an update throughout the state. Thanks.
Good afternoon, everyone. My name is Jeff Smith, and I work for the North Carolina Department of Health and Human Services Division of Mental Health. Our director, Dr. Vogler, was not able to be here. He had a family emergency he had to attend, but he wanted me to welcome you all and thank you for participating in the Governor's Working Group. If y'all don't mind, I will just go directly to the other co-chairs. Director Belos, would you care to update the troops, sir?
Good afternoon, everybody. I'm Mark Belos. I'm the director of the U.S. Department of Veterans Affairs Regional Office out of Winston-Salem. There are two events that we have, one event going on and one event coming up that I wanted to announce and make you aware of. The first one is we're holding a Veterans Benefits Action Center, and there's also a stand down in Wilmington today, tomorrow, and Saturday. It is at 5102 Oleander Drive, the Elks Lodge in Wilmington. Our folks are going to be there. Our decision makers are going to be there. We're going to sit down with veterans who have pending claims, try to get those decided, try to move those to the next stage, or at least explain face to face what's going on with that claim. We also have folks there from the Health Administration to talk to folks and take applications. We will also be there to take new claims. So if there's new veterans in the area who have not filed claims before, we encourage you to come in and talk to us. That is important. So we will be there the rest of today, tomorrow, and Saturday. As of 8 o'clock this morning when we opened up, there were 100 people waiting. So we're expecting a huge turnout. Last year we had almost 800 people at this event. And we're partnering with the American Legion, New Hanover Veterans Council, and Congressman David Rouser to put on this event. Another event that we have coming up on April 26th and 27th. I believe that's a Wednesday and Thursday, but I'm not sure. At the Goodwill Industries on University Parkway in Winston-Salem, we have another Veterans Experience Action Center where we will be doing the same sort of event to service veterans who have pending claims, appeals, or veterans who haven't filed their claims yet. So we're looking forward to that event. We haven't done an event in Winston in a couple years now. For those of you in the room, there are some flyers on the table, and you can please take one of those, replicate them, pass them around if you want. But I wanted just to announce those two great events, and if you talk to anybody, please encourage them to attend. Thank you.
Thanks, sir.
Now I'd like to introduce the Deputy Director for VISN 6, Ms. Linda Exner, and she's going to give us some VISN updates.
Good afternoon, everybody. Ms. Seacon sends her greetings. She's apologetic that she can't be here today. She's in Washington at the National Leadership Council meeting, so I'm standing in for her. We've had a really, really active March. As many of you know, we've had 4 director vacancies in all 4 of our North Carolina facilities, ranging from as long as 9 months to 4 months this past year. And we're very pleased to say that starting early March, we've been able to fill all of those vacancies, and they've been coming on board. We have Stephanie Young, who was the previous director at the Danville, Illinois VA, who has joined the Asheville VAMC as director there. We also have Paul Cruz, who is the new director at the Durham VA, who was a former associate director in San Francisco, but for the last 9 months prior to taking this position, he's been the interim director at the Buffalo VAMC. So very pleased to have him on board at Durham. Joseph Vaughn joined Salisbury just this past week. He was previously the associate director at Jackson, Mississippi, and all of these three individuals have had a long career with VA in many administrative positions, so we're extremely excited about the depth and strength of our bench that we have now in North Carolina. And last but certainly not least, joining us in the first week of April will be James Laterza. He is retired colonel from the Army, whose last post before his retirement was as the commander of Landstuhl Medical Center in Europe, in Germany. And he was previously also in the European Theater in England and a variety of posts in the continental United States. So especially for Fayetteville, this is wonderful news because we've got a really active partnership with our DOD there already at WOMAC, as well as in Camp Lejeune and in our Goldsboro CBOC. But this is just a wonderful coup for VA to get somebody with these credentials to come in there and help us to expand our partnership with DOD that we already have initiated and really expand that to the really positive benefits to all of our veterans and our service members. I don't know if you know, but one of the high priorities in VA across the board for this next year is really focusing on our transitioning veterans, those that are leaving the military and coming into the private sector community. So again, we'll have a wonderful opportunity to have a pilot for just how we can do that and do that well, so that there's a warm handoff between DOD and VA, and they immediately get connected to the services that they have earned during their service in the military. So we're very excited about that. And last but not least, our growth continues at a really explosive rate. I know that it varies from 6 to 13% across our VISN, and our Fayetteville market is the highest growth area of all of our markets in the VISN. And we've added additional square footage over the last year, but most recently our Jacksonville area is still extremely crowded. We've opened a new lease in Jacksonville that'll have 2 to 3 PAC teams. And I'm also pleased to say that our Raleigh Healthcare Center, which is a 180,000 square foot facility that will have not only PACT but mental health and specialty care, and that is on track, and it's entering into the A&E, the architecture and engineering phase of that project. So we're actually seeing that it's moving down the track through all of the gateways in VA central office that you have to pass through to begin to activate something of that size. So a lot of work has gone on. We have a lot of work yet to do, but again, we're extremely excited about having our now full complement of all of our leadership vacancies filled across the VISN in North Carolina and Virginia, and continuing on the good progress that we've made to date. Are there any questions? Yes, sir.
Question. Thank you. My question has to do with following funding to maintain this tempo of growth and what you see from the vision where the shortfalls might be coming.
Well, we do have to have a very tight balance between our growth and our funding. And as some of you may know, our reimbursement model in VA actually lags behind about 2 years. So the work that we're doing today actually begins to show itself in dollars of funding 2 years from now. But I think with the good management that we've had and the way that we've been able to accelerate and exploit the community partnerships through our choice funds has enabled us to, keep up with it. Certainly in certain areas, we've not been able to be as nimble as we would like. It's difficult to recruit providers in this market because we're in competition with the private sector as well. And North Carolina is a growing state. It's wonderful, but there's a lot of people coming into our state. So for right now, I think we're holding our own. We're certainly talking with Congress about possibly streamlining, some of those financial barriers that we have. One of the things that there's been a bill introduced in the House to consolidate all of the community care funding into one pot. Currently, there's about 5 different pots of that money, and you can't move money from one to the other, et cetera. So they're listening, and they do understand that North Carolina has specific challenges that perhaps a lot of the rest of the nation doesn't have. And so we feel like we've got good relationships with our congressional members and those that are on the committee that, steer the finances for VA. So I think we're holding our own. Certainly we'd like for it to be a little more timely, but for right now, I think we're holding our own. Thank you for the question.
I have one more too.
Okay.
Can you tell me when you might be opening to the rest of the VA medical centers the ability to do electronic medical appointments through My Healthy Vet?
Actually, that's already available. A lot of the veterans choose not to exercise that option, but we are making a concerted effort that at every appointment that we do check in with the veterans and see if they want to enroll in that. There's apps where you can actually do it on your phone, and so we're introducing all of those things. But we have a fair percentage of people that still like the more traditional methods of enrolling. Yes, sir.
Hi, Graham, DAV. Right now, there's only 3 transitional service officers across the state. We have a good working relationship with Camp Lejeune and Seymour Johnson. As of right now, the transitional service officer at Fort Bragg is not allowed to go in any of the TAP classes. Can we explain on that or expand on that?
I honestly am not aware of that issue, and certainly like to talk with you after the formal part of the meeting to get more details, and we can look into that.
I can answer that question. The TAPS class is a Department of Labor program, not a Department of Veteran Affairs program. So the contractors from the VA are a part of that, but it's a Department of Labor program. So you're going to have to go through that agency to see if you can get permission to speak to the soldiers that are going through their transition. Also, it's a partnership between the Department of Labor and the North Carolina Department of Military Veteran Affairs, and Secretary Prosser can answer a little bit on that too as well.
Yeah, also, just to let you know, there's a new program that's coming out next month, and I have been on the conference calls with them in D.C. on the implementation with the VA, and they promised us that they will have local representation allowed at all bases once the new program takes over. So that was one of our concerns as well, from the state, of us not being able to get into the TAP. Some bases we could, some bases we couldn't. And so that is one that we've addressed, and the new contractor, it's part of their contract that they have to let us in, whereas some of the contractors before didn't. So it's supposed to be included, but they have revamped TAP completely. It's going to have a whole new different curriculum starting next month.
I do too. Appreciate that update. Thank you. Anything else? All right, thank you.
Thank you, ma'am.
Director Prosser, if you want to just slide right in. Go from. All right, I'll just continue with those remarks. First of all, Secretary Hall is sorry he couldn't be here today, but he is in Shelby at a Vietnam Veterans 50th commemoration, and I just want to let you know we have one of those coming up March 29th at the Capitol grounds. We'll have one in Raleigh. They're going to have one in Charlotte at BBT Knight Stadium. They're going to dedicate a POWMIA seat that they will have in honor there at the stadium. They also have one in Lumberton coming up, I think, next week. So we need to make sure that you're aware of these events, and you can find those on the website. A couple other things real quick. With our budget requests, we're still working for our cemeteries and trying to get some funding for those. And also with our nursing homes, I just want to let you know that last night, the omnibus bill that passed through the committees that are going to the House and the Senate today, hopefully, they expect it's probably going to be signed and go to the president by Friday as well. And if he signs that, in addition to that 100 and some million that I mentioned last month in the nursing home construction budget, they dropped in another $575 million, which means we may get both of our nursing homes this year. And that would be awesome, except for the people that have to plan and build and buy the property and all those things. So we are looking forward to that and gearing up toward that. Also, just want to mention about our county support payments that we give to the counties each month. Those have been processed today, and so all the veteran service offices that had requested our assistance should get their checks on Tuesday. And speaking of the counties, we see the same thing that the VA is seeing as far as their patient enrollment. We're seeing that with the veterans. For 10 years, when I was down at Charlotte and was a director down there, we always had the highest veteran population in the state. 3 years ago, Wake County pushed above us and knocked us down to number 2. And I'm surprised to say, but pleased to say, that Cumberland County is now number 1, and they've knocked both Wake and Mecklenburg out of the running there. So Cumberland County, as she mentioned, is not just for the VA healthcare, but all veteran population is rising down there. In fact, they're all making gains, and we're happy to try to help them and get more folks in and get them helped and get them their claims done and keep working with that. And that's all I have for right now, but I'll be back.
All right, we're going to now do the update for suicide prevention initiatives. Jeff Smith is coming back out representing the Department of Health and Human Services again.
Thank you, Moses. I just wanted to follow up a little bit on our November 7th statewide practice improvement collaborative to reduce veteran suicide. There is movement that is taking place, and all of the various members of the working groups, organizations are doing things to respond to the findings and help to sync things better. And I just wanted to highlight a few of those things before folks come up here. I mean, they're just all of these problems are solved by cooperation and collaboration, and that is what we are seeing across the state of North Carolina right now. As Director Bilo said, for the very first time, we have a combined stand down and VBAC. That is a huge event. We've been working towards that for several years. We have 4 NC Strives student veteran conferences across the state in the month of April. And one of the breakout sessions in each one of those regional conferences will focus on QPR training or mental health first aid training for veterans, give practical skills to folks who work with student veterans across the state. These are real live tools that we are sharing with our coworkers to make significant gains. One of the additional things that I wanted to bring up to everyone is there's a program that the Department of Military and Veterans Affairs developed with Duke University, and our department is very happy to continue the funding of it. It's called the Veteran Support Specialist Program, VSS. And the VSS program is designed to help folks who work frontline with veterans have a better skill set and tools, things like deconfliction, motivational, interviewing, a whole list of skills. Things like community mapping skills, knowing how to take out the resource guide and find the best resources for the veteran that you're helping. And so I just wanted to let you know that those 2 things will be taking place in Western North Carolina, May 10th in Asheville. And in Eastern North Carolina in Benson, May 17th will be the first sessions of this VSS project. If you are a member of the National Guard or one of the LME MCO support teams, we would very much encourage you to join these. Much like, and we're very happy to hear that the Veterans Affairs and Commerce are doing joint training sessions for the first time in it. Okay. So that's my 2 minutes.